So I need someone to read this case for us. Causes of epistaxis, please.
A 35-year-old presents to the emergency department with recurrent episodes of anterior nosebleeds over the past 2 months. He reports frequent nose picking and dryness in his nasal passages, especially during the winter when he uses central heating without a humidifier. He has no history of trauma, chronic illnesses, or medication use. What is the most likely cause of this patient's recurrent anterior nosebleed? A, low
Please finish.
ambient moisture content. B, nasal neoplasm. C, hereditary hemorrhagic telangiectasia. D, hypertension.
Okay, doctors, before we move on, based on the information we have in the question stem and based on the answers we have, don't even choose the right answer for me.
Okay.
I just want to know, will hypertension be your answer? If yes, why? If no, why not?
No,
Why?
hypertension will not be the answer
What in
because
the question stem tells you that
not
hypertension is not the answer?
nothing in the question is suggestive of hypertension. Patient
I-
is not on any medication. He has
Mhm.
no issue of medication use.
And what else? What other word or expression was used that helps you to know that hypertension is not the likely answer?
No history of chronic illnesses.
Simple. Good. Will that same principle apply to hereditary hemorrhagic telangiectasia?
Yes.
Beautiful. What about even nasal neoplasm?
Yes.
So you realize that with just this keyword, no chronic illnesses,
Yeah.
we've been able to eliminate B, C, and D.
Yes.
So now who is standing alone?
Low ambient moisture content.
Now, is that the correct answer?
Yes, because in the history,
Mhm.
the patient uses central heating without a humidifier.
Thank you very much. So you realize that these are the tricks we need to have in order to, be able to get the best out of the question. So that is what is happening. He reports frequent nose picking and dryness. Why? Because there's low ambient moisture content in the air. Why? Because of the centralized air condition. So somebody, oh, but Dr. Bonnie, why can't it be nasal neoplasm? Why can't it be hereditary hemorrhagic telangiectasia? Because the question also says he has no history of chronic illnesses. So the question can even be broken into 35-year-old male with, dryness in the nose, who has no humidifier, with no chronic illnesses. What is the most likely cause of his recurrent anterior bleeds? And it's also beautiful because the word recurrent. So that means, so far as this dry environment is kept, this patient is going to get these recurrent episodes all the time. Okay. So low ambient moisture content. And this is the correct answer. Low moisture content in centrally heated rooms can lead to mucosal dryness and irritation, which is a common cause of anterior nosebleeds, especially during the winter months when humidity is low. Why is nasal neoplasm wrong? This would typically present with other symptoms such as unilateral nasal obstruction and facial pain. So if you want to pick up nasal neoplasm as your answer for a patient who has epistaxis, look out in the question stem for words like unilateral nasal obstruction. Look out for a word like facial pain. What about hereditary hemorrhagic telangiectasia? For that to be your answer, this condition often leads to more severe bleeding and is associated with vascular malformations, right? Why is hypertension wrong? Even though you realize that hypertension is associated with nosebleeds, the patient's symptoms are more suggestive of a local irritation because he's picking his nose, it's always dry, that kind of thing, right? Okay, good. Now, I need another one to read this case for us, please. I need someone to read this case for us, please.
A 55-year-old female with a history of hypertension presents to the clinic with a posterior nosebleed. She is on antihypertensive medication and aspirin for cardiovascular prevention. The bleeding is profuse and difficult to control. Upon examination, no obvious trauma or foreign body are found, and there's no history of drug abuse. Question: which of the following factors most likely contributed to this patient's nosebleed?
Doc, before we move on,
Yes.
now the question stem was talking about no history of drug abuse. Which drug abuse is associated with recurrent epistaxis? Sorry, what did you say?
Cocaine, sir.
Beautiful. Answer options: hypertension; 2, aspirin use; 3, intranasal drug use; and D, nasal trauma. What should be your answer?
My answer would be hypertension.
Hypertension. Beautiful. Why hypertension? Why didn't you go for aspirin?
I wouldn't go for aspirin because I think hypertension is a known cause for nosebleed.
Beautiful. Beautiful. So the correct answer is hypertension. Why? Hypertension is associated with an increased risk of epistaxis, particularly posterior bleeds. Okay. Long-standing hypertension contributes to vascular changes, making nosebleeds more likely. Now, aspirin. While aspirin, which is an antiplatelet, now, who can tell me what other antiplatelet do you know apart from aspirin?
Clopidogrel.
Clopidogrel or Plavix, right? While aspirin can increase the risk of bleeding, the patient's history of hypertension is a more significant factor. So aspirin can also cause bleeding, but when you have aspirin and hypertension, go for hypertension. Now, what about intranasal drug use? The patient denies a history of drug use, making this option unlikely. What about nasal trauma? No trauma was reported or observed on exam, so it is an unlikely cause of the posterior bleed.